CHAARTED2 or ecogacrin 8153 is a randomized phase 2 study assessing the role of adding Cabazitaxel to Abiraterone to patients who have previously received docetaxel for castration-sensitive disease, but eventually progressed to develop castration-resistant disease. The results of CHAARTED2 were presented at 2024 ASCO, and the study was positive for the primary outcome of radiographic progression-free survival. In the initial analysis, there was a PFS benefit of 5.5 months for the patients who received the combination of Abiraterone plus Cabazitaxel versus Abiraterone alone. At this meeting, we presented the results of the circulating tumor cell analysis, which was one of the exploratory parts of the study. During the course of the study, we collected samples for CTC analysis at 3 time points: at baseline, prior to cycle 5, as well as at the time of disease progression. We were able to collect CTCs from 94 patients from each arm. Just to remind you that the total number of patients in the study was 223 patients. And based on that analysis, we found that the presence of circulating tumor cells as well as AR-V7 at baseline was an adverse prognostic factor for both treatment arms. We also found that there were more patients who converted from CTC positive to negative and also from AR-V7 positive to negative for the patients who received both Cabazitaxel and Abiraterone versus Abiraterone alone. And finally, we found a potential small trend towards an improved outcome from the combination of Cabazitaxel plus Abiraterone for patients who were AR-V7 both at baseline as well as at day 1 of cycle 5. So the conclusion of the study is that patients with positive CTCs and AR-V7 at baseline, they had a worse outcome regardless of treatment allocation. We also found that patients who received Cabazitaxel plus Abiraterone, they had an improved PFS regardless of the presence or the absence of CTC and AR-V7. And also there was potentially a small trend towards improved PFS for patients who were AR-V7 positive at baseline as well as on day 1 of cycle 5.